Mr. Motz, 5 minutes, please.
Thank you, and congratulations, Commissioner, on your posting. It's good to have you here today. Now, the government seems really concerned with the benefits afforded to criminals, and I'm concerned about public safety, and in that public safety are the correctional officers, and who are at risk due to some of our government policies that you've been asked to implement. For example, in May, the current Liberal government announced a needle exchange program in prisons, contrary to the current Drug-Free Prisons Act. I guess I'm curious to know, did Public Safety Canada, Health Canada, or any other department discuss the plan with you or your team, or with the union, or with the management of these facilities prior to that decision? Yes or no?
It was the Prison Needle Exchange was a CSC initiative, and actually it's in keeping with the broader Government of Canada harm reduction strategy. And before we implemented it, we did speak to our union partners. And actually, at this point, it's a very slow implementation. It's only at 2 sites, at Atlantic and at Grand Valley Institution. It's phased in implementation. Actually, I have said to all the unions that I'm more than prepared to sit down and discuss it.
Okay, well, just so you're aware, Commissioner, I've heard from them, and they tell a different story. They're quite concerned that again, the frontline correctional officers have the potential of being impacted by a weapon being in the hands of a violent offender and an addict. They're concerned about that, and I'm concerned that this decision will have a negative risk and an impact on frontline officers. So I would certainly encourage you. The story I'm hearing from them directly is different than what I'm hearing from you. So there's obviously a disconnect. I guess one of the concerns that I have also is you've rolled this out slowly, you say, and there's only 2 institutions that this needle program is implemented in. Surprisingly or interestingly, one of those institutions had its first heroin overdose in 15 years. I'm wondering how you reconcile that, the whole concept that prisons are supposed to be places where prisoners remain drug-free. I can tell you story after story of prisoners that I've locked up personally who said, "Thank you, I got clean in jail, and it wouldn't be for jail, I'd be dead." And yet this is not good for our inmates. So I'm just curious to know how you can reconcile that with the Drug-Free Prisons Act.
Well, certainly for us, drugs are an issue. We don't want drugs in our institution. The fact is there are drugs, and but the Prison Needle Exchange Program is a harm reduction measure. As you know, in CSC, we've been providing condoms, dental dams, bleach for a number of years. With the Prison Needle Exchange, I just want to mention that in terms of the safely managing needles, we have had success with the threat risk assessment model, which is the model we use for EpiPens and insulin needles, which we have right now in our institutions.
Well, that's fair, but if you are as concerned about the safety of prisoners, which you need to be, and that's your mandate, and I respect that, we also need the same respect and care and concern for those correctional officers in there who run a risk. Now, just to shift. So according to an